by not biting completely on the question. Because part of the problem with all of these programs is, and the reason they're going bankrupt sooner, is because the economy stinks. Okay? Revenues are down. They're paid. All of these programs are supported. Medicare and Social Security is supported with payroll taxes. And when you're at 9 to 10%, and realistically, as you know here, not just in Lancaster County, which is over 15%, but if you look at the people who are stopped looking for, you had 16, 17% unemployment in the country, probably over 20% here in Lancaster County. So, and I'm sure the sheriff will tell you that he sees the results of it in the crime rate here, and what's going on as a result of people's frustrations and not being able to work. So that cost goes up. So first thing we need to do is we need to grow this economy. That's number one. But to answer your question as to how you deal with Medicare, back in the 1990s, I proposed a solution to Medicare that's very, very similar to what Paul Ryan has proposed. Okay? And if you look at the Medicare prescription drug plan, I was asked that question last night. You know, Senator, you said you're conservative, but you voted for the Medicare prescription drug plan. And I said, I did. I said, I didn't like the deal that George Bush put on the table before it even came to the Congress. And the deal was that it was going to be universal. In other words, it was going to be a universal benefit, A, and B, it wasn't going to be paid for. Now remember, at the time, we had just finished 4 years of having a surplus. And we had a deficit of about $100 billion. And so paying for things didn't seem like the highest priority. All right? So it was a different time. Today, obviously, we would have never done that. But it was a different time. And so Bush made the deal, in my opinion, for the wrong reason. He wanted to get the issue off the table. And I said, okay, how do I take this deal and make it the best possible for the long term? So we did several things. I'll talk about the one that's the most important for the answering your question. And that is, we designed the system to be a system that was publicly funded but privately operated. In other words, the government would agree to pay a certain amount of money and would structure the broadest parameters of the insurance policy. And it would say, as we did say, that there would be good, strong coverage for initial prescription payments up to a couple $1,000, and then we would cover catastrophic care. In other words, people who exceeded, I think, $4,500 in prescription costs. So we created the template and then said, insurance companies, you take and do whatever you want to do. If you want to fill in that hole because you can do it efficiently some other way, fine. But that's how we're going to fund it. We're going to fund an insurance policy that prices out based on this model, but you're flexible to do whatever you want to do if you can do a different model. Okay? But you're going to suffer the economic consequence. In other words, if you design a program and you do it and seniors end up spending more money and you lose money, don't come to us. We're paying for this. You want to design something else? Some companies did. Some companies cut out name brands, just provided generics, and as a result, we're able to provide broader benefits. We've got all sorts of prescription drug plans out there. Anybody participate in the Medicare prescription drug program? Anybody here? A few of you? We designed that plan saying seniors were smart enough to go out and with help from the insurance companies, from senior counselors and others, to be able to pick a plan that worked for them. And guess what happened? It worked. Seniors are generally happy with the prescription drug coverage they have. It's not perfect, but it prevents against catastrophic loss, which is the big concern. And two, it came in 40% under budget. Why? Because you have skin in the game. You have to get co-payments. If you reach that donut hole, in other words, you're going to have to pay every dollar, which means, ouch, I'm going to have to, I have to pay up for this. And so what happens is seniors have to become shoppers, consumers. And guess what happened when seniors become consumers? It came 40% under budget. The reason I went along with that plan is I said, here is a great template for how Medicare can work, which is instead of having one-size-fits-all government program, we have a program that sets a structure up but leaves and says, here's how much money we'll put forward, and leave seniors the opportunity to go out and pick and choose the kind of plans they want. If they want a plan that doesn't give you lots of choices, but lots of coverage, you can get that. If you want more choices and less coverage, you can get that. If you want more choices and more coverage, you can get that. And by the way, you're going to pay more. Okay? But those are the choices that we believe seniors could live with. That's how we're going to imagine. How many people think there's waste and fraud in the Medicare program? Why? Okay, government's involved. Why is there waste and fraud in Medicare?
People encouraged to cheat.
Why?
No skills.
Raise your hand. Winner. Okay. Give her, I don't know, we have anything in the back and give her a bumper sticker or maybe something like that. She said, because seniors don't have any skin in the game. You're not consumers. You get a bill, you go to the hospital, you get a bill, you say, here's all the charges, all the things, and you pay, $233 and it's a $30,000 bill. How many of you are going to go through and say, I don't remember getting that, or gosh, they charged me that much for that? I wouldn't pay. How many do that? Anybody do that? Okay. And you know what? And you call Medicare and they say, forget about it, right? They don't care. We need to have consumers have skin in the game. And it's not just Medicare. It's all health. We have been conditioned in the oddest way when it comes to health care that somehow or another, someone else should pay for every health care expenditure you have. I mean, think about how absurd that is. I mean, I'm not talking about open heart surgery. I'm talking about going to the doctor. You get covered for going to the doctor. You get covered in having an x-ray for your ankle that you twisted. Why? Why? How many people have auto insurance? Raise your hand. How many people does their auto insurance cover oil changes? Getting your tires replaced? Filling up your gas tank? Okay? How much do you think you pay for your auto insurance if it covered all those things? Ooh. And how many people would like to fill out the paperwork to get your oil changed? Okay, how many people here have food insurance? Raise your hand. No Glenn Becker's here, okay? He's been selling that for a different thing, but wait a minute. What's more essential? Food or health care? So if you have a right to health care, why don't you have a right to food? You should all have food insurance. No one should go hungry. No one should have to decide between food and iPhones. That's immoral. Everyone should have their food covered. Okay, let's say everybody had their food covered. Now you all have food insurance. And you go to the grocery store. At the beginning of the month, you drop off your payment. Oh, you're a senior couple, let's say it's $500 a month. Okay, you drop off your food insurance payment, and now you got your insurance card. And you go up and down the aisles, and there are no prices on anything. I mean, know what the prices of any medical procedure out there is. Right? No prices on anything. Nobody knows what the price is. So you just go and you see this, ooh, I like that. That in here, I like this, I'll put that in here. I think I need that. I think this will make me feel better today. Let me have this. Right? We put it all in our cart, go to the checkout, and they scan it all, right? And they come up with a number, and they say, whoa, that's $643. But for you, $43.22. You pay your $43.22, your co-payment, and you go home. And the next day you say, I don't really got nothing better. Let's go to the grocery store again. Right? How many fat people would we have in there if that were the case? I mean, imagine. Obesity, you think is a problem now? You talk about overutilization? This is the healthcare system in America, folks. And we wonder, why does it cost so much? That's why it costs so much. Because there's fraud and waste and overutilization because people don't pay for their care.